Welcome to Talking Points. I'm Esme Murphy. You're hearing a lot about AI these days, but have you heard of what's happening at the Mayo Clinic in the breakthrough of diagnosing cancer, specifically pancreatic cancer? Pancreatic cancer is the 11th most common cancer in the U.S., but it's the third deadliest. Half of all pancreatic cancers are first diagnosed when a patient is already at stage 4, and the 5-year survival rate is just 13%. But with AI at the Mayo Clinic, it's a new ballgame. AI can see cancer in patients that the human eye and other sophisticated medical diagnostic machines cannot. That means diagnosing that cancer on average 438 days earlier than it would normally be diagnosed. And that means dramatically better patient outcomes. Joining us to talk about this is Dr. Matthew Callstrom, the chair of the radiology at Mayo, and also, sir, you are the medical director of AI strategy at the Mayo Clinic. Thank you so much for your time.
Esme, great to be with you today.
Tell us how this has changed the world of diagnosing pancreatic cancer. This is saving people, giving them years, I would think.
Well, Esme, I think the stage we're at is we're right at the beginning of launching a clinical trial to prove how well it works. The model that's been developed, runs on CT scans, and with this, we can see things on a CT image that, I'm a radiologist, that we don't see with the naked eye as easily. To compare how well it works, I'm about 50% in terms of being able to pick up these early stage cancers, where this model that's developed can actually pick it up about 97% of the time. And so what we need to do is take that model, apply it to patients at high risk for pancreatic cancer first, and prove how well it does identify these early stage pancreatic cancers.
But it is detecting cancers that the naked eye can't see, or that some other machinery, because you obviously have access to the best there, can't pick up.
Yeah, so how it works, I think it helps for people to understand this. What we did is we took CT scans of patients that were diagnosed late, like you just described, and went back in time and had CTs from those same patients earlier, in advance of their diagnosis, trained a model on those CT scans, and now find that we can identify those cancers at a much higher sensitivity than we do just trying to read the studies by ourselves with the naked eye. So really, between the AI model running on the CT scan and the radiologist, you really have a much greater opportunity to pick those early stage cancers.
And the way you teach the computer, I was reading, you're actually feeding them 1 million slides, so they go through that, and then one example is 5 million slides. I mean, that's really amazing.
Yeah, the way you do this is you actually take that CT image and identify where that pancreatic cancer appeared later, and then the model trains and picks out those small differences in the pancreas that ultimately designate where that pancreatic cancer is. So you basically train that model to be very sensitive to those findings.
What other applications does this technology have in terms of other cancers or diagnosing other ailments?
Yeah, it's a great question. What we're really trying to do is early detection and interception of cancer, as we apply machine learning or deep learning, and also use generative AI solutions, these large language models that you're hearing about, to train on really large data sets. You talked about 5 million. That's one of the models that we've built with all the digital pathology data that we have, where you can actually start to characterize the different types of cancer cells, for example, on a slide, even an unstained slide, and be able to help the pathologist in their role in identifying these cancers.
Let me ask you, how much time and how much resources in terms of dollars did it take you to get to this point where you're about to go to clinical trials?
Yeah, time's a great measure. We've been working in AI at Mayo for more than 7 years. And we started with the machine learning, which was kind of more the typical way that people have been doing this work. And with this, across the organization, we've deployed about 90 different models that run every day in the background. All of these have a human in the loop. What they're doing is helping us do our jobs better. If you look at the last 2 years, it's really accelerated with these new capabilities around applying AI techniques to large amounts of data, whether it be imaging, digital pathology, things like voice. So you can start to characterize, and identify cancers and other conditions using these sorts of approaches, but more than 6 years.
Your staff was kind enough to send me some video of the SuperPOD, and all I could think of looking at it was sort of the early days of computers where it was an entire room, and it took years to get to that point. Am I right in that analogy or off? Does that not equate?
Well, the latest generation GPUs that we just installed in our SuperPOD working with NVIDIA allows us to go much more efficiently in building models, and we can work with much larger amounts of data to do these models. Compare where we were maybe just close that out, Esme. A couple years ago, we had just a few GPUs. We could actually do these machine learning models. The large language models require huge amounts of data, and that's why that SuperPOD's important. So we can experiment and learn with the different types of data that we have, go after more complex questions.
How far away are we from the point where I go to the Mayo Clinic with elevated blood sugar and you put me through these tests and boom, you've got it. You can detect them very early, not stage 4 cancer, but perhaps stage 1 or 2. How far are we from that in terms of time?
Yeah, if you talk about the pancreatic cancer model, when we do this clinical trial, it'll probably take us, about a year to enroll patients to do this and validate it. And an important point of this is that as we develop these models, we deploy them and test them just like we do a clinical trial. Make sure we build the data, the evidence that shows how well it works. So when we do apply it and somebody does come to the clinic and has their CT signaling that there's some concern for pancreatic cancer, for example, we know very well how well that model behaves and how we should deal with that finding.
So a year to put together a clinical trial, and then how long before it's actually in use in hospitals such as yours?
We're going as fast as we can. It's pretty hard to answer that question. I think, we know how important a problem it is that we're going as fast as we can.
Let me ask you, does AI, this kind of technology, does it make a mistake?
Yeah, it's a great question. I'd answer it a little bit differently. AI, what it does is it gives us maybe a prediction or a probability that there's an issue. So if you think about pancreatic cancer, there's going to be where we're clearly identifying a cancer, but it also might signal something that isn't a cancer. And so that false positive is a really important thing to manage. So you can imagine coming to the clinic and getting a result from this model that's been run that says, you might have pancreatic cancer. Very worrisome, a lot of anxiety that comes with that. So we have to make sure that we can determine very accurately whether or not that's truly a cancer or not. So you go to that next level, maybe follow somebody very closely and make sure we can find out whether or not that's a cancer or not, or apply other techniques like liquid biopsy to refine and identify whether or not there's truly a cancer.
And let me ask you, do medical centers such as yours work with other centers around the country? I imagine this kind of research and the kinds of advances that you're talking about here with pancreatic cancer are happening in terms of other research groups as well.
Yeah, that's a great question. What we've built is a platform where we have our data loaded, and all the data that's there has been de-identified and certified so that we can do research like this with that data. Other centers across the world have also joined the platform. So now when you build a model, you can actually make sure that that model kind of sees other types of data so it's not biased in terms of how it performs, improves its performance. So I think that's one important vehicle that we have to bring in diverse sets of data and make our models better.
All right. Well, listen, Doctor, thank you so much. This is really fascinating. We'll continue to follow this evolution, which is really life-changing, obviously. Thank you so much.
Thanks, Esme. Great talking with you.
And that does it